India is in the grip of a second deadly wave of coronavirus, with record numbers of cases being reported every day. Oxygen is running out, vaccines are running out, and hospitals are being overwhelmed. My colleague Madhura Kapdi joins me from the capital Delhi now to tell us more. Madhura, we've heard a lot about the crisis you're facing in India, but can you tell me how it's affecting children there?
Adults are grappling with it. You cannot imagine what's happening with children. With so many adults, caregivers, and parents falling ill, children do face a trauma. Increased number of children are calling helplines, asking for support. The other big crisis we've seen is that India's healthcare system is extremely brittle. With a crisis like this, what has happened is that the current set of caregivers and healthcare workers who work at the front line have been diverted towards COVID-19 duties. So these are people who used to regularly give children vaccinations, who used to make sure that they have access to full healthy meals every day. And so hence what has happened is that these services have been stopped.
And this crisis is especially difficult for rural areas. Why is that?
In rural India, the healthcare system, like I mentioned, is not very well placed. It is not robust. The primary healthcare system only is able to deal with very basic facilities and basic illnesses. In the current COVID crisis, the staff is unavailable. Healthcare centers have been converted to COVID centers. We've also seen places where some healthcare centers may not have anything beyond a paracetamol. They won't be able to handle the crisis or manage the illness in such a scenario. The question of oxygen being available and cylinders and proper refill plants being available in rural India is a distant one. None of that is really readily available. So it is going to be extremely difficult for rural India and children who live in the hinterlands to be able to access any services or access health care in the current crisis.